So education is a very important topic in America today, and you've clearly identified that vision problems have a big impact on people's ability to be successful in education, and 3D vision being part of that. What's your thinking from the AOA side as to how you might be able to leverage this kind of current climate in terms of getting funding or awareness of education programs, vision screening in the education system?
Well, it all comes down to, not that I'm also, I'm director of policy and health sciences for the association. And a lot of this does come down to policy because it's where the regulations and the policy can have the biggest impact. So in terms of children getting to care, we do have, it's number one, identifying that our current system is not working, that it's broken, and then how to fix it. We talk about the high rates of false negatives and the impact that those false negatives have. If a child is screened with an insensitive test and they're told they don't have a problem, they take that problem, they carry that along with them as an anchor throughout their lives. Many of these kids get frustrated in school. They can't attune to learning. They tend to gravitate toward other things. They become behavior problems in the classroom. And as many as 20% of children currently being treated with for ADHD only have a vision problem that's been undetected and untreated. These are kids being medicated when they should be taken to an eye doctor for care. We have a big problem. Just think about how many times you've seen a criminal mugshot of somebody with glasses on, okay? It doesn't exist, almost, unless you're talking about white-collar crime, okay? And then if you look at, there's a study, some studies done looking at juvenile delinquents, entry-level juvenile delinquents. They did comprehensive eye exams on them, mostly for the first time in their lives. Over 50% of them had undetected, untreated vision and eye health disorders that were amenable to treatment if they were caught earlier. That's huge. That cannot continue to go on. This collaboration will help identify those kids, get them to treatment, and really be, has the capacity to be probably in the biggest thing for children's vision health in the last century and a half.
I agree. You make great points. What are the specific steps, the roadmap, the policy changes, the steps you need to take?
Well, hopefully one of our first steps was the healthcare reform bill. Part of that was the getting children's vision as an essential benefit. And I want to kind of underline the word essential. That doesn't mean supplemental, ancillary, that type of thing. Currently, right now, that's going to start in the year 2014 with the state exchanges, which has potential to grow in all the states. To be honest with you, it's been a little bit frustrating out there that there's been some debate about whether or not you should just do a screening, as Mike has talked about here, Dr. Duenas. And again, that gives a false sense of security out there. And again, as you've heard from these lectures today, there's a lot more to vision than just covering one eye or the other. There's a lot more to it. And I want to say this, I'm an everyday practitioner. I only, as the AOA president, I get to practice 2 or 3 days a week versus a week now because I'm usually traveling. But I'm telling you, you see this all the time. People with learning disabilities, they're quote-unquote labeled earlier in life. A lot of the people who are juvenile delinquents, unfortunately, we have a detention center that brings patients over week to week, and guess what? They have undiagnosed vision problems. Not all the time, but a high proportion than what we see in day-to-day practice life.
I think one of the things, too, I can comment that we're expecting to integrate a lot of our work, whether it's the human factors group that you have with our own clinical staff. We, for example, have a health promotions committee. We have a group that works in Washington on policy issues. We have a group in AOA that assists the states in reforming requirements and regulations in the state. For example, the fact there are only 3 states that require a comprehensive eye exam before entering school. So there's a lot, we have quite a big list, and I think over the next several months you're going to see that starting to take shape. But the essence of it is that finding any channels in which we can empower the American people with this information. the information that when you're symptomatic or you have discomfort or you can't experience the virtual 3D opportunity, that's a sign. It's a sign, get your eyes examined. So it's all revolving around that, and I think you're going to see this unfold. That's why it's important to keep tabs with the new website we developed, 3dihealth.org, and that's where you'll have both organizations contributing content. And of course, you have your 3D university.net. We have our own AOA.org. So we're going to be using social media and our web presence to get the information out. It's primarily a public education effort. I think the opportunity for research collaboration, we, for example, had an opportunity, this group, earlier today to tour research facilities and clinical facilities at State University of New York. And I think that was a buzz going about some ideas for how we can cross-pollinate some research concepts from the doctor side to the technology side. In many ways, this is a marriage of doctors and technology experts, all with the goal of improving the quality of life for Americans.
Dr. Sheedy had a couple of more comments about children, but before I go on, the other part of that approach, we've been talking about children, let's don't forget about adults. And that's what we're working with now to make sure in the value-based healthcare purchasing system that we're fixing to enter into over the next couple of decades, that we make sure that a comprehensive eye exam is part of a basic eye health exam or of health insurance. Because quite frankly, we find issues like diabetes and hypertension, not to mention decreased performance at work, like Dr. Dwayne has said.
Yeah. So from the programmatic and the side of things, actually getting the work done, there's one of the efforts that we're taking on initially is a 3D in the classroom guidelines. This is a document and assistance for teachers around the country who are using 3D already in their plans and who might be looking to it in the future. It's an easy add-on for a projection system, which of course is highly utilized in the classroom. To make it a 3D projector. It's an awesome way to teach math and science, and teachers need to understand, and the children and teach the children how seeing 3D is how this information is coming to them in 3D. It'll be another opportunity to diagnose their 3D vision and their capability in seeing 3D. So that's one of the elements that I wanted to make sure came out here. We're really looking forward to implementing this across the country in the classrooms that already have 3D capability, and then encouraging other classrooms, maybe developing other programs where we can get more 3D projectors or possibly direct view systems into the classroom to help instruct students at that level. So right from the very start.
Glad you brought that up, Heidi. That's a program we're very active on already. We get sort of some great momentum in that collaboration, and it fits in with another AOA initiative that we're now linking with 3D at Home, and that's the upcoming Washington Summit on school readiness and vision. That's an event that's happening later it's month of April. We're going to be hosting that in Washington. We're going to have information about this summit meeting. This is a gathering that was organized some year ago, and the key person in charge of that event is Dr. Dory Carlson, who was hoping to be here today, but her son had an appendectomy yesterday, so she could not be at this event. Dr. Carlson is a great champion of our infancy program and our children's vision program, and we already had convened major players, the Department of Education, the Head Start Association, the school nurses, the teacher associations, PTA associations. It's a mix of all of the organizations that you would expect would be stakeholders in the importance of school readiness. And the key part of school readiness, since 80% of learning happens through the visual system, is quality vision. So we're now going to make a connection between this new partnership we have and this Washington Summit meeting. And we think that will potentially lead to policies at the federal level, education policies and payment policies that relate to this issue. Dr. Sheedy?
I'd also just like to add, and Chris, I think we're still on your question. I think we can use vision problems at computers as a little bit of a prediction of what's going to happen here. We're very early in this 3D game, but if you look back at vision problems at computers, I mean, in effect, the AOA helped to establish the name on the symptom and did a lot of PR about it. There were clinical practice guidelines that were established that were sent out to the practitioners to help to guide them to say, here's the type of stuff you should be doing. So there's communication to the doctors, and then there's communication to the public. And the AOA has also been very good at developing pamphlets and brochures and things like that. So if I look at my tea leaves here, I think all of that's going to happen with 3D also.
And you should know because you were involved in that effort as well, Dr. Sheedy. So I think you've found another wave to catch with an important area.
It's the second wave.
I know. Some more questions? Yes.